Hi, welcome. I am trying to learn medicine. Today, enlarged adenoid. Now for this download, we're gonna do median plane training. And if you participate in the median plane training, then it's better the own risk. And we're talking about internal anatomy, a disease, or a disease. And this is part 2, and this is no medical advice. We're just reading about it and learning about it. Enlarged adenoid. The adenoid is a single pad of lymphoid tissue. Okay, this is a pad of lymphoid tissue, and the tissue that helps to protect the body from infections, that is lymphoid tissue. And it lies at the back of the nose, close to the point where it joins the mouth cavity. It is small at birth, but begins growing at about the age of 3. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Enlargement of the adenoid may block the opening of the eustachian tube, the tube that connects the middle ear to the throat and to the nose, resulting in otitis media. The adenoid may also obstruct the flow of air from the nose to the throat, forcing the child to breathe through the mouth. The flow of air through the mouth can then cause the tonsils to become larger. Now I read it now through the introduction, because I'm wondering what of that is now part of enlarged adenoid and what of normal sized adenoid. Is lymphoid tissue at the back of the nose, around where? At the back of the nose. Who's it? The back of the nose or the lymphoid tissue? At the back of the nose, close to the mouth cavity. Small at birth, but begins growing at the age of 3. It reaches maximum at the age of 8, and by puberty no longer causes obstruction. Enlargement of the adenoid may block the opening of the eustachian tube, that is the tube connected from the middle ear to the throat. So, it doesn't really make sense. Enlargement of the adenoid may block the opening of the eustachian tube. Eustachian tube is the tube that connects the middle ear to the throat. Now, if we read it without the brackets, may block the opening of the eustachian tube into the nose. Goes not to the throat, but to the nose. Then from here to the furnace. Oh, that's we don't know. It blocks eustachian tube, which goes from the from the middle ear to the throat, or to the nose, resulting in otitis media. Okay, when the adenoid is enlarged, then it results in otitis media. So I think that's inflammation of the middle ear, because the eustachian tube cannot lead what is there through the eustachian tube from the middle ear out to the nose throat. The adenoid may also obstruct the flow of air from the nose to the throat. From the nose to the throat, forcing the child to breathe through the mouth. The flow of air through the mouth then causes the tonsils to become larger. The flow of air through the mouth then causes the tonsils to become larger. I don't know where the tonsils are. I said it in the first part, I don't know where we're going actually in the details. I don't know where we are. But we could just say it when we're talking about the enlarged adenoid, that the tonsils become larger. As soon as we or other people who understand it, it's clear. The adenoid is small at birth, but begins growing at about the age of 3. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. By enlarged adenoid or normally. Symptoms: breathing through the mouth, blocked nose, snoring, nasal speech, deafness, recurring otitis media. Duration: mouth breathing and a blocked nose may last for months. Recurrent ear infections or deafness may occur over a period of months or years. Now the problem is that we don't have a fundamental idea or the fundamental fundament of enlarged adenoid because we don't know what is normal. It doesn't make sense to explain it if it is not normal. To say 3 at the age of 3, at the age of 8. It doesn't make sense if it is normal. But what is not a normal thing? But it does not grow, it's just there. Or it is not enlarged. Causes: recurring or long-standing infection of the adenoid. Complications: repeated ear infections and deafness. Treatment in the home: there is no home remedy for enlarged adenoid. It is a normal process of childhood and is best ignored unless there are complications. Let's read that again. There is no home remedy for enlarged adenoid. It is a normal process of childhood and is best ignored unless there are complications. It is a normal process of childhood, or does it happen just normally during childhood? When to consult the doctor: if a child has earache or deafness in one or both ears lasting more than 4 or 5 days, if the nose is blocked for more than a month, and the child is unable to breathe with the mouth closed. What the doctor might do? I don't think it is normal that children cannot breathe through the nose. And it wouldn't really make sense to write an enlarged adenoid. It would make sense, even if everyone has it. What the doctor might do: examine the ear and mouth, test to see how well the child can breathe through one nostril at a time, test hearing, send the child to an ear, nose and throat specialist. The specialist may decide that an operation is necessary to remove the adenoid and possibly the tonsils at the same time. Recovery is usually rapid. Outlook: from the age of 8, the adenoid decreases in size, and both the risk of complications and symptoms decrease. The specialist's decision to operate on it depends on reaching a balance between symptoms and age of the patients. Let's take a look if we find the tonsil somewhere. You have the tonsils. The tonsils. Whatever. There, by 11 there. Lovely. See those bright white thing comes in the end there. At the back of the mouth. Do you have an explanation? I don't think so. Okay, I don't really know what we should do with it. Maybe almost nothing. Or just a little bit about where the lymphoid, the adenoid is. Because I can't get further. Maybe we just forget about it and just explain enlarged adenoid, and we don't have to explain now. At one point, it's logically that not everyone has it, so it's not normal that people have it from the age of 3 to 8. It might be occur most of the time during the age of 3 to 8. I think that is it, but anyway, way all the time. So I just don't know how to continue now. Which means we will continue the next part. Maybe with a better idea. We will do another medium plan training. If you are here for if you were here for medicine, you go directly to the next part of medicine. We will do another medium plane training. If you stay and participate in the medium plane training, medicine. You bring one leg up and the body with a foot down. And take the other leg up and the body. And we're going to the side. The toes are pointing forward and we're stretching the inner side of the leg. And over to the other side. The toes are pointing forward, we're stretching the inner side of the leg. And now the mantis, go from side to side. And back into the middle. And now bring one leg up into a right angle with a flexed foot, have even lined hips, be tall on the back, and press from the top against the knee and have a little bend in the elbow. And the other leg up, same setup, and press from the top against the knee. And the other leg again up, and now press on the side against the knee. And the other leg up, and press on the side against the knee. And next exercise, one leg again up, and the knee presses up to the side, up to the side. And the other knee up, and the knee presses up to the side. And the last exercise already, the heavy swing door, one leg up, same setup, and press from the outside against the knee, and open slowly. And close again. And open again. And close again. Another time. And the last time. Down the leg and the other leg up. And press on the outside and up slowly. And close again. Up again. And close again. And now for the last time, open. And close. And leg down. Now legs wide apart, the finger down. And breathe out. In. Out. Now we're feeling close the legs. And breathing out. Now it was for medium plane training. I thank you very much and until next time.